Last week, Superintendent Dr. Thompson released that there was a positive COVID case within the Norwood School District. During the spring and summer, in partnership with the health department, the school administration worked tirelessly to put the proper protocols in place if there was a positive test result. Once finding out about the most recent positive case, the school administration acted quickly.
Our procedures and protocols were based on ongoing conversations with the Board of Health, and that started last March when we were dealing with the initial outbreak here in Norwood. Those procedures for cleaning and how we're going to conduct ourselves are all in that reopening plan that is on the school website. That was first released the beginning of August. I keep referring people back to that document. When we designed our hybrid model, we did it to maximize and try to keep cohorts separate so that you've got a group of kids in for one part of the week, you have a break, and you have a group of kids in for the second half of the week. And the reason for that is that there is a separation, at least in the schools, so you don't get two cohorts, one cohort infecting another cohort. So we were very purposeful in designing that methodology. So from that, we continue to have conversations, go through scenarios. You know, technically when you talk about strategy, you talk about table talk exercises. We did that with the Board of Health. And there is another document that is on the website that goes through that. This was released the end of August to families, and again, posted on the website. And it goes through what the different scenarios are. So, and basically what happened last Friday is that we had a positive case. We had a positive student. We worked with the Board of Health. We had our nurses working with the Board of Health last spring doing contact tracing. So they are very up to speed with that. But the Board of Health, as well as the school nursing and the school administration, worked to contact trace to identify close contacts who could possibly develop symptoms. If you are considered a close contact, then you would be asked to quarantine for 14 days, because usually symptoms and being able to infect others happens in that time frame. A close contact is someone who has been within 6 feet for 15 minutes or more. That is a Board of Health definition. That is a CDC definition. It is following the guidance. And I know a lot of people out there think that, well, I think this and I think that. We are following the best advice of the public health professionals. The close contacting is not happening in the schools. So even though there were teachers in the rooms with that particular student for a day, they were not a close contact because of the social distancing, because of the mask wearing. So, you know, what we ask and, you know, what has happened is that we are asking parents to daily go through the checklist. The checklist was shared out a week and a half ago. Again, but for just as school reopened, again, it is in the reopening document, but it goes through what the symptoms are, and we should go through and kind of self-check if we have any of those. And if you are exhibiting those, just on the abundance of caution, stay home, see if those symptoms develop, and if needed, get a test.
The newly formed Facilities Department also responded quickly with a deep clean of the school.
First, it's really important to know that we have been spraying in the schools for the last 4 years. We started working with the nursing department and spraying for flu season, for any stomach viruses. So all our guys are comfortable and well equipped to do the spraying. And what we're doing now is we've increased our contact disinfecting procedures. We're doing it every day. The teachers do it in their classrooms after each of the classes. And then at night, we thoroughly go through the schools. We're doing bathrooms every half hour to 40 minutes. And on Wednesdays, which is the deep clean day, we actually do not only the disinfecting, the hand disinfecting, but we spray the whole building with disinfectant. And we do that again on Friday night and Saturday, or Friday night or Saturday, excuse me. So we are, I think, ahead of the curve, and we have enough product, and we're just going forward, and as things change, we adjust and adapt to those changes.
Thank you to all the departments for implementing the protocols that were put in place. The quick response kept many people safe.